Very good morning to all. At the outset, I would like to thank Dr. Jayant to give me this opportunity to speak on this topic. So as Dr. Jayant mentioned, so all of us sometime in our career we are facing this dilemma. What is the best option for us? So at the end of our fellowship or even after completing our PG course, most of us face with this situation. We have a lot of options available in front and we are not sure, and many times we don't have idea what are the different opportunities available. We often go with the flow or whatever our peers or seniors have been doing. So post fellowship, retina fellowship, we'll just try to list out few options which are available and then see what are the positives and what are the challenges for each of these options. So we have options like a government institute, it can be a central or a state government institute, a private institute, either a medical college or a tertiary institute. We have the corporate hospitals. It can be either private or solo practice. It can be an old setup or a new setup. There are various trust or charitable centers, and there are various fellowships as well. So coming to the tertiary eye care institutes, there are various institutes, as you all know. The Arvind system, the Shankar Netralaya, LBP, and Narayan Netralaya, etc. So the positive sides are they provide very high quality work, and often we have access to the best of the instruments, the latest equipments, and all the facilities are available often in these centers. And also there is an academic excellence, daily, weekly classes and webinars are being conducted. And the most important thing is we have our mentors with us during the initial period. Most of us who have completed our fellowships and continue in the same center, we still have the mentors to guide us, especially in case selection and any surgical complications. So that is one advantage. So post, as far as retina practice is concerned, post fellowship at least 2 to 3 years of further experience is needed till you gain confidence for a separate practice. So in that case, presence of a mentor is very important. So often we know in a tertiary eye care institute what is the future for the next 3-5 years. We have a chalked out plan. And then once you do a good work, you get good recognition across the institutes. And we have a decent job security as well. And as far as the workforce is considered, we have good assistance in the OPD, OT, and also the fellows and the PGs are there. And if very troubleshooting is there in any aspect, a quick action is possible. However, few drawbacks I would like to point out here. The working hours may be often long. So day often starts by 7 o'clock in the morning and ends at 7. So this is one drawback, and the distance from hometown. So most of the tertiary eye care institutes may not be suitable for many candidates who are still continuing there. And leaves are limited. Most of the public holidays, most of these hospitals are working, and family life may often be compromised in the long term. And the salary to begin with is also often fixed. Once you complete your fellowship, you start with a salary of around 1 lakh, and maybe at the end of 3-4 years, it goes around 2 lakhs. So in that aspect, it's a bit a drawback. So next we have the corporate hospitals like the Agarwal, ASG, Vasan and other hospitals. So the positive sides are usually the requirement in these corporate hospitals, most of the time they will ask for at least 3 years of surgical experience post fellowship. However, the freshers also have opportunity. Usually in the peripheral setups, they will be given the opportunities. They also have a good setup, access to the best instruments and the well-trained staff. The geographical location for this corporate hospital is often preferable. You can get these hospitals in the tier 1 and tier 2 cities. The salary is often high. Starting salaries may be as high as 2 lakhs to 3 lakhs. So in that aspect, it's good once you get an opportunity in one of these hospitals. And often a customization of the working hours is possible for the lady doctors with kids or just starting a family. You can also choose the timing of work, maybe the morning or afternoon shifts. So that is a possibility. So you can give your time to the family whenever you need. And the growth is often proportional to the productivity. And again, any troubleshooting is there, quick action is possible. Similar to the institutes, tertiary eye institutes, the working hours can be challenging. It can be often a long day, and some corporates grade the doctors based on the revenue generation capability, and also the leaves are also again here limited. And also there might be an additional burden of completion of target. So that is one aspect which is often challenging for many surgeons, and the management work responsibility may have to be taken in such institutes. Next, the solo or private practice. Often if you have already an established setup, it becomes easy to go and join your own setup with maybe a family hospital or a relative or someone who is already have the setup. So here the positive is that you can decide your timings and everything. So decision making is easy in such situation, and customized schedules is again possible, and earning again depends on your practice. If you have a good patient inflow, the earning is there is no limit to that. Once you are 3-4 years into a private practice, you can have a good inflow of patients, and leaves and all this again you don't need any permission. However, although this positive side is that the challenges are often more in a private practice. The financial investment to start a retina practice is huge, and the management skills you need, managing staff, hospital administration knowledge often becomes very mandatory in this setup, and decision making in clinical situations is important, and often you have to deal with other subspecialties apart from retina. You need a team of doctors for all other subspecialties, and again stocking up instruments, consumables and non-consumables is often difficult because you have to take care of all these aspects yourself. The sterilization can be again challenge. The protocols you have to strictly follow, and also you have to have the setup for sterilization. So all this adds up more pressure sometimes for a solo private practice. Often if you are in a group, it becomes you can divide the responsibilities. Also you need good rapport with the local administration for any troubleshooting, and you have to have good rapport with the supplier of the consumables, non-consumables. And if already a corporate setup is there nearby, it may be difficult to flourish your private practice. So last option, one of the last option will be the government institutes. So there may be autonomous or central institutes. But one thing we should remember, for joining in a central or an autonomous institute as a faculty, we need at least 3 years of senior residency or research experience. You need some publications, and preference for those with fellowship from reputed institutes. For state governments, it's often 1 year senior residency is enough. So one thing you have to remember is most of the fellowships in India are not recognized as teaching experience in these institutes. So only the research training is recognized. So that you have to keep in mind. Otherwise, you have to do a 3 years assessship, senior residency, any of the institutes. So these are few of the institutes where the vitreoretinal facilities are already established, and if opportunity arises, we can apply there and try to join AIMS New Delhi, PGI Chandigarh, JIPMER, and some of the newer AIMS also have that. Among the state government hospitals, we have the GMCH, Nagpur, Chandigarh, AIOC at Calcutta, Patna, Trivandrum. So these are few of the options available. So we have to look out for the vacancies in these institutes, and then apply for the job whenever its opportunities arise. Again, coming to the workforce, we have the PGs and the SS to support. So those who are interested in academics, institutes are the best place. You have MBBS teaching, PG teaching, and you can be an MBBS examiner once you are associate professor or above after 4 years of experience. PG examiner once you are additional professor, that is after 6 years of experience, and you can go to other institutes as examiner. So that is one of the positive side. And also research facilities are better in these institutes. You can do faculty projects. You get grants up to 5 lakhs in the central institutes for each project. Then you have the student ICMR projects, faculty ICMR project. Then you can be a guide for PG thesis or a co-guide. The intramural and extramural funding are easy to get, and you have vacations, which is almost 39 days per year in a central institute, 30 days of summer vacation and 9 days of winter vacation, and all the public holidays you get leave. Then you have the time-bound promotions in the central institute. It's assessment promotion scheme. Every 3 years you can appear for the interview, and also other facilities like learning resource allowance of around 1.5 lakhs per year to get research assistance in the form of buying any of the research material which is needed, and also allowed for conference visits, international and as well as national. So some of the challenges are new recruitments are often limited in such institutes. There are often hierarchies present, and equipments and consumables may be limited, reuse of instruments like cutter and forceps, limited resources and limited OT turns, and often a mentor or guide for vitreoretinal surgery may be absent in some of the newer institutes. You might be often the only practicing VR surgeon, so that becomes a challenge. Some of the times you have to look at all the aspects of it. how to manage the OT, how to manage the OPD. However, these challenges again helps to you to develop your all other skills apart from your surgical skills. So again, intravitreal injections, as you know, most of the government institutes, the patients visiting will be poor, so they may not be able to afford. That becomes a challenge. And purchase procedures for the consumers is often a challenge in this. So other few options after completing fellowship, some of you can join SICS training or FACO training for 2 to 3 months to hone your surgical skills. Then you have the trust of the charitable hospitals where you can good hands-on for surgery. Then there are various options for international fellowships, like in UK, this is the most preferred one. If you can, those who have written FRCS Software Part 2 and IELTS OET, they can avoid the, bypass the PLAB examination and directly join in many of the institutes. In USA also, you can join either if you have completed USMLE and then subsequently you can apply there. However, in these two, California and Pennsylvania, these two states in USA, you don't need USMLE, direct entry is allowed. Other options are like Canada, Australia, New Zealand. So these are some of the international fellowship options which are often very lucrative and nice to do. You have clinical research, clinical plus research fellowships. And these are also few of the exams which you can write after your fellowship. So finally, the decision depends on what do you want. So you should be clear in your mind and then look for all the options available. And then you have to have a family considerations, and then you should finally consider how can you make a difference where you join, and you should be able to finally make a difference. It's no point joining a place, already there are many vitreoretinal surgeons, you will be just another person doing the surgeries there. So always I would suggest to join in a place where you can make a difference. So thank you.